Hello, everyone, and welcome back to another episode of All in All with Alex. I'm your host, of course, Alex. Today we have a very special guest with us. I know y'all know, I'm not so good with names, so I don't even want to butcher her name like that. But you know what? I'm gonna try it. Miss Karese. I can't say the last name. I know the last name is gonna be,
It was
uh,
perfect. You got the
okay,
first name like 100%. Karese Laguerre.
okay. That wasn't the bad now. Okay, Laguerre. Okay. So can you give the people a quick background about yourself, and then we'll dive into the questions?
Absolutely. I am a registered dental hygienist, but I don't practice clinical dentistry anymore. I am a myofunctional therapist full time, and I know there's going to be a lot of questions coming about that later. But I am very, very passionate about breathing and sleep.
Okay, perfect. So, what inspired you to transition from traditional dental hygiene to myofunctional therapy?
My children. And I think that that's an answer that I guess a lot of us might give, those of us who are parents. Our children always inspire us, in some ways change our lives. And for me, they changed my career. So I am a mother of four. I have four children, one boy, he's the oldest, and then he's been disappointed every time I've gotten pregnant since because he's got three little sisters. And all four of them had a lot of different issues. Now, I like to say that when we as parents are asked, how's everything? How are the kids? We always get the highlight reels. This one's in karate. This one's got a dance recital. Like everything's great. But underneath all of those wonderful pleasantries is the reality. And for me, my household reality was that my son had a lot of attention and focus, behavioral, social, emotional issues that we struggled with for a while. My daughter had, my oldest daughter, I should say, because there's three of them. My oldest daughter had every sleep issue under the sun. You name it, we experienced it. Sleepwalking, falling out of the bed, tossing and turning, night terrors, bedwetting, like everything. 10 years in a row, every single night, we were guaranteed some type of issue. And more often than not, a combination of issues. And then my youngest two daughters had a lot of upper respiratory issues. So whether it was ear infection, throat infection, congestion, like it was always some mix of that upper respiratory system seemed for them to not work very well. So all of my children had very common things. Like a lot of people struggle with attention and focus issues with their children, or sleep issues with their children, or upper respiratory issues with their children. And traditional medicine kind of dismissed it away. Oh, they'll grow out of that, or oh, here's some antibiotics. And it just wasn't something that was handled in that arena in a way that I felt truly comfortable about. It actually took a pediatric dentist that I was working for at the time while I was a hygienist who put together the pieces for me that a lot of what they were experiencing, though it was common, none of it was normal. And a lot of it stemmed back to the way they were breathing and using their orofacial muscles. And so that drove me down a deep rabbit hole where I, fell in love with myofunctional therapy, and I got to meet my kids for what I say is like the very first time on the other end of everything. So my son, he had all those attention issues, but that was really a sleep issue. And we didn't know that there was such a large overlap between ADHD and sleep, that his misdiagnosis as ADHD and us medicating him, that wasn't necessary. That once we treated the sleep, he was actually able to thrive. And this poor boy who was struggling with school for so long, once we got to the root of his sleep issues, he actually wound up graduating college, not college, high school. He wound up graduating high school a year before his peers at 17. And so very, very proud of him. My daughters, all of their sleep and breathing issues have been resolved. Like we haven't had any antibiotics in my house in, I don't even know how long, it's been years. And so I'm just very grateful for this myofunctional therapy journey. And it's all thanks to my children. They've inspired me. And because of our journey, I'm inspired to help others.
Okay, cool. So, the story is definitely amazing. Can you dive just a little bit deeper into what myofunctional therapy is and how it differs from other therapies?
Absolutely. So, myofunctional therapy, I think it's almost a little bit of a misnomer because it's not like therapy in the way that people would think about most therapies. It's kind of more likened to personal training. So it's kind of like having a personal trainer for all the muscles below your eyes, but above your shoulders. So it's all the muscles in this wonderful region here that we're working to strengthen and coordinate, because we find often when there's dysfunction in that area, that's going to impact your digestion, your breathing, your sleep. It really just has like a trickle down effect on a lot of different things. And so myofunctional therapist is kind of like having a personal trainer who's able to really get to a root cause of any issues that you have muscularly below your eyes but above your shoulders.
Okay. Okay. So, how does the MyoSpots approach connect oral wellness to whole body wellness?
Yes. So I love my practice, the MyoSpot, because it really goes beyond just myofunctional therapy. I really like to involve diverse approach to how we're going to handle everything, because nobody gets to dysfunction or gets to illness or dis-ease by any one mechanism of action, right? It's always multifactorial. So I like to address it from a couple of different angles. So the MyoSpot is really my way of helping the public through myofunctional therapy, through energy work. We do some primitive reflex integration, we do some cranial nerve integration, and we really take dynamic breath work to a whole nother level by including all of that and making sure that we're addressing the person for the totality of what all may have gotten them to where they are. That way we can approach wellness from a broader scope.
Okay. Cool. Um, so here's an interesting one for you. What are some common misconceptions about tongue ties and their impact on overall health?
So anytime people think about myofunctional therapy, they immediately associate it with tongue ties. And then anytime people think about tongue ties, they immediately associate that with babies. And if you're going to, keep going down this rabbit hole of, you're thinking about babies with tongue ties, you're probably thinking about the New York Times or the Atlantic or some of the other journals and publications that have recently written about the proliferation, like how many more tongue tie procedures have been done in these recent years as compared to in years before. Here's the thing, tongue ties are something that people will look at and may identify immediately by looking at it as a structural problem. But the root of the issue is always something in dysfunction. So when it's a baby and it's an infant, typically they're having feeding issues. So they might be struggling to latch and to nurse, or they might be struggling to feed with a bottle, or they might be struggling just feeding overall. So just being able to get enough nutrients, and they might be in failure to thrive. But that can happen for any number of reasons. I think it's often just narrowed down to a tongue tie. And then when there's an immediate release without seeking any providers to help, then it makes it look like a tongue tie fad. And that it's just a trend in order to do a procedure, but not really to help the parent. So it's 100% something that is very valid. It's a complete misconception that it's not a valid thing. It's just we're looking at it in the wrong approach. We need to start looking at it, start directing people in the right way. Because more often than not, what happens is that we have the wealth of information that we all have on the internet, and moms wind up on social media rabbit holes and in Facebook groups, and then they get misinformation from other parents who may have had an easier journey than their potential journey might be. And then we have a whole bunch of confusion. So to really narrow it down, whether it's a baby, whether it's a child, or whether it's adult, a tongue tie really all stems down to dysfunction. And it's really important to get a functional provider in your team. So seek one of those out first. So if it's a baby, it's a lactation consultant or a feeding therapist. If it's a child, it might be a myofunctional therapist, a speech language pathologist, an occupational therapist. If it's an adult, it's more often than not a myofunctional therapist, but you want to have somebody on your team who's going to be able to identify where your dysfunction is and if the tongue tie actually is a problem, or if it's something we don't need to deal with at all.
Okay. So how do you address TMJ disorders through myofunctional therapy?
That's a really great question. So TMJ disorders are more oftenly, commonly termed as just TMJ. But TMJ, just so that we can have like a little anatomy lesson, is the joint. So our temporomandibular joint. So it's that lower jaw. Anytime you open and close your mouth, if you put your hands right by your ears, you'll feel that jaw joint. So that's the joint. That's the TMJ. And it's got several attachments to it through muscles. There are muscles that insert and innervate that area. These are our muscles of mastication. So our muscles of mastication, they can become overworked, overdeveloped, and spasm and create pain and create issues. And what our myofunctional therapy programs do is we teach you how to unwind some of those negative patterns that you're doing. We start working on jaw grading and appropriately how we're going to use the jaw and how we can ride on that joint better. And we're going to help take those who might have clicking, popping, pain, or disc displacement, and we're going to help them re-strengthen that area so that they can create a new pseudodisc, hopefully eliminate or reduce the popping, and get through the pain. So we're going to put in some work. That way we can get to wonderful riding on that joint, and then you can open and close with a little more peace.
Okay. So can you discuss the relationship between oral health and sleep apnea?
Absolutely. So a lot of people don't think enough about how the mouth is connected to the rest of the body. And I'm going to blame that a little bit on our system that's so disjointed, where we have like eye care, we have dental care, and then we have like whole body care, as if the whole body doesn't include the eyes or the mouth.
Right.
So when it comes to sleep, I think a lot of people might think of sleep and you think of it in a way that's really disjointed, where you might be thinking maybe breathing through your nose, or just that sleeping is just something that happens in the subconscious. But sleeping is a whole body activity. And respiration, which is like the number one thing for all of us as humans. So we can go for weeks without food, days without water, but not any of us can go for anything more than a few minutes, perhaps, without air. So our bodies need that oxygen more so than anything else. And what happens is when we go to sleep, the first stages of sleep are muscle relaxation. So muscle relaxation mixed with the forces of gravity, more often than not, can take some muscles that just aren't as well strengthened or developed and can make you more prone to closure. That closure of your airway for 10 or more seconds is considered an apnea. And when that happens multiple times a night and you get a sleep study, it can be officially diagnosed as obstructive sleep apnea. So let's take a look at it, and we'll take a step back and we'll take a look at it from another type of analogy that I like to use. So let's imagine someone with six-pack abs. This person with six-pack abs lies down and they're getting ready to go to sleep. The first stages of sleep, muscle relaxation, and then gravity puts a pull on them. Do we think that those abs are going to disappear? No, right? More often than not, somebody has six-pack abs, John Cena goes to bed at night, six-pack abs are still there, right? They don't go anywhere. But you take somebody who might have a beer belly or a different type of shape. Now you lie them down. First stages of sleep are muscle relaxation, and then we have the weight of gravity, and everything will shift. That beer belly suddenly doesn't sit up as high and round, like things have moved and shifted. And if we think about our airway like that, because our upper respiratory tract is a lot of soft tissue, if we think about our airway like that, when we have muscles that we're not really using, we're not really focused on, because most of us, we go to the gym to work out muscles that are shoulders down. Nobody's thinking about the fact that there's over 100 muscles above our shoulders. When we don't work out these muscles, they wind up becoming more flappy, for lack of a real better medical term. And when they're like that, it makes us more prone to having that closure. So where myofunctional therapy and having good oral health and good oral function comes in is that you're strengthening that area so you can have that six-pack airway that's holding itself open, as opposed to what's the number one treatment for obstructive sleep apnea? It's a CPAP machine, which is a continuous positive airway pressure machine. And that forcibly holds open the tissue. So it's a constant stream of air that is forcibly holding open the upper respiratory tract. But what if it can support itself? What if you could actually sleep and have a peaceful night without having to worry about that collapse? So I think it's incredibly important that we start to think about our body as one total unit, and that all of the health is really starting from where we're breathing, because without that, we've got nothing.
Right. I would agree. So, what inspired you to write Accomplish How to Sleep Better, Eliminate Burnout, and Execute Goals?
I think the fact that we're not having enough conversations about sleep in the right regard, that 100% inspired me. So when we talk about sleep, or people talk about poor sleep, we might often say, okay, well, maybe it's because you have your lights on at night, or you're watching too much TV before bed, or you don't have the right mattress, you don't have the right pillow. But you could change all of that and potentially still not get adequate enough sleep. One, because of the analogy we just kind of mentioned earlier, where you might be still having muscles that cannot sustain and support a nice patent airway. And when you have that, you can't really breathe well. And the body's number one objective is to keep you alive. So your brain's gonna wake you up with every single apnea and say, hey, breathe. That way you get back into breathing. And then that's when we have these multiple arousals at night. That's going to be like the number one thing. Two is the snoring. Snoring's a big thing too, because snoring, you're actually hearing a little bit of that narrowing as the air is struggling to make its way. So it's the sound of air meeting resistance going down your upper respiratory tract, right? So we don't talk enough about how snoring might be very common, but that's not normal. And if we started having better conversations around these two things, I think people would be able to leverage really true restorative sleep, because once you're breathing and your body's not having to work on multiple arousals to keep you breathing and to keep you alive, it's able to actually restore cells. You get cell rejuvenation, your immune system is able to restore, your brain is able to adequately cleanse, memories are able to be input. There's a wealth of wonderful things that happen during sleep that we can't have even if you have the right pillow, even if you have the right mattress, even if you have the right conditions where you're not on your phone right before bed and you're doing all the right things, quote unquote, as per like a simple Google search for sleep hygiene. Right. I think that it's important for us to have deeper conversations. So Accomplished is my labor of love. That's my gift to the world, like a very easy to digest way to really understand how you can leverage improved breathing for improved sleep, which will improve your productivity, which will improve your efficiency. So that's how we get sleeping better, eliminating burnout, and executing goals.
Okay. Yeah, I like it. I'm no doctor or anything like that, but I always say, the better sleep you can get, the better you can function, throughout your whole day. So, sleep is definitely very important. And I'm probably the last person to say that, considering I don't get much of it, but I'm still functioning for now. So I got to just get a little better on making sure I get sleepy.
Yeah, definitely. Because we sleep for like a third of our lives. It's incredibly important that we are on top of it.
Yeah. I've been here for last 10 years or so. I've been making sleep maybe like more so between a third and a fourth of my life. You know what I mean? So it's been less than 8 hours, but maybe slightly more than 4. So but okay. I got to get it back to that 8.
Yeah.
So anxiety. So how can you help clients overcome anxiety through your oral wellness techniques?
I love that question. So, one of the first things that happens when you go to see a psychiatrist or a psychologist or any type of therapist with issues about anxiety is they start to teach you breathing exercises. There is a large research link between breathing and anxiety. There's an even deeper and greater link between our tongue and how we're able to connect to our vagus nerve by having our tongue in a proper rest position, which I'll get back to in a second. But when our tongue is connecting and really stimulating our vagus nerve, we're able to communicate with our autonomic nervous system. That's that fight or flight, rest or digest system, and being able to regulate between the two is a true power for those who have anxiety, because often they're running on that high sympathetic tone, which is that fight or flight, and it really does disrupt their lives. So breathing, we know, is very well linked. The tongue, we know, is very well linked through our dynamic breath work, through our ability to really help people establish proper oral rest posture. So that's that tongue. Our tongue at rest should be lightly suctioned up at the roof of our mouth. So from just behind the teeth on the palate, all the way back to our soft palate. We want our tongue to be lightly suctioned up against there. And in that wonderful sweet spot with the back of the tongue, really suctioned lightly against the soft palate area is where you're going to get that stimulation for the vagus nerve. And that's where you're going to find the magic. So a lot of what we do is very indirect. I'm not ever really targeting anxiety as a whole. I'm just teaching better systems and techniques that are going to help them be able to better manage. And a happy accident that does occur for some people is that there is a reduction in anxiety. There's a reduction in ability to more appropriately manage those symptoms.
So, do you ever is there certain signs that you can notice that someone might benefit from myofunctional therapy? Like, if you never worked with them before, like, you see any signs that will let you know, like, hey, they'll really benefit from this?
Absolutely. So, one really good sign is that your sleep quality is just not good. But your sleep quality is not good because specifically you feel like you're being woken up multiple times an hour, you're gasping for air at night, you might be a heavy snorer or a heavy breather. A lot of people talk about heavy breathing. Breathing is not something that we're ever supposed to hear. If you're hearing your breathing, air is meeting resistance as it's trying to get to your lungs. And I don't know about you, but if I heard that food was trying to meet resistance as it's getting to my stomach, I would address that. And so I think people with that same level of urgency need to address any type of audible breathing. So hearing breathing, whether it's day or night, mouth breathing, an inability to really close the mouth and really respirate through our nose is a very big sign. We want all of our oxygen to be filtered through our nose. So what happens is our nose is going to be the only place where we'll be able to filter and humidify that air that's coming in and then produce nitric oxide. That way the air can adequately bind to the receptors for the hemoglobin, and then we get that appropriately flowing throughout the body. And so it's incredibly important that you're aware of how you're breathing, what's going on in your mouth. If you have any orofacial pain, that's always a good indication too that you're a really good candidate for myofunctional therapy. Tongue ties, but as we talked about, tongue ties, I think myofunctional therapists should probably be one of the first calls for those, as opposed to a release provider who would just, surgically revise that.
Okay, so how has teletherapy changed your practice, and what benefits does it offer clients?
I think telehealth has really revolutionized the way that we're able to provide care. So, myofunctional therapy is not something that a lot of people have heard of. And I guarantee you, for the amount of people that know of it, there's maybe half a therapist for everyone that really does need it. There's not enough therapists. And with the telemedicine, teledentistry, teletherapy, with the increase in the use of that, we've been able to really improve our access to care. And that's the biggest thing for me. So telehealth has allowed me to see people all over the country for the United States, to see people internationally. I've seen people all over the world, from far reaching as Australia, closer, Canada, Mexico, Costa Rica. I've seen people all over the globe. And I think that that's the best part, because you can go anywhere and you could probably find a dentist or some level of a dental specialist, but you can't go just anywhere and find a myofunctional therapist. But with the power of teletherapy, you can now. You're just one click away.
Right, that's right. Um, so I know I'm kind of jumping around. So okay, so how do you approach treating children versus adults in the myofunctional therapy?
Oh, I love that. Children are very malleable. By the time a child has reached age 4 to roughly 6, they've got about 40 to 60% of their craniofacial growth and development done. By the time they hit age 7, it's roughly 75 to 80% of that craniofacial growth done. I mean, when you still have that growth potential, that is phenomenal because that means that the work that we do with the muscles are going to have a big impact on their growth trajectory and their ability to grow and shape faster than it would in an adult. So with children, it's a little different in that one, we're making it more playful. They're hardly ever accountable for a lot of what happens. It's always the parents having to be on top of them, like, do your exercises, make sure you're doing this, pay attention, and all of those types of things. But with adults, you have to do a little bit more work because now we're unwinding muscle patterns that have been there for 20, 30, 40, 50, 60, however many years, right? So when we are working with adults, it's a little bit more focused, a lot more explanation. The kids don't care why they're doing the exercises, they just care that they have to do them. And so we make them fun. The adults care why they're doing the exercises. So we're talking about what muscles you're working, why you're doing them, how you can really leverage it for improvement in breathing, improvement in chewing, improvement in swallowing, improvement in, your jaw function. And so it's a lot more explanatory, but you get good results with adults in the same way that you do with children. It's just children, you see it so much faster. They're so easy to mold, and they just change. Change happens quick with them. Whereas with adults, you wait a little longer, but you will get great results too.
Um, so what are some simple exercises that people can do at home to improve their orofacial function?
Yes. So I think the first thing that I would recommend before we start getting into some simple exercises, the very first thing I would recommend is a nasal hygiene routine. It's incredibly important. The foundation of myofunctional therapy is proper oral rest posture, and that includes the lips being closed and breathing primarily through the nose. But a lot of
Mhm.
people sometimes don't have that patency there, or they just are not able to really access it. We clean all the rest of our body. It's incredibly important. I can't stress enough the importance of cleaning our nose and being sure that our nose is patent and ready for respiration. So I would say before you start trying any exercises, do some nasal hygiene. That way it's going to be something that helps keep you nice and clean. A saline rinse, a saline irrigation system. When people hear saline irrigation, they always think neti pot. It doesn't have to necessarily be a neti pot, but something that's going to clean out the passages. After that, then you can start to think about doing some exercises. One of the best ones is really conscious meditation. So, conscious breathing, being aware of your breathing, manipulating your breathing, getting that awareness and being able to start, stop, pause, extend your inhales, exhales, or do breath holds is powerful. You can change your body chemistry with just the way you breathe. And so having a conscious awareness of it is going to help you and be most beneficial. Then, third thing that I would say, as far as exercises and what to do, is that you really want to start working the six pack airway that I was talking about earlier. So, if you can gargle, if you can hum, and if you can do things that will really engage this pharyngeal space, you're going to benefit significantly from it. So, gargling and trying to hold that, or humming and trying to hold that for upwards of 20 to 30 seconds. It's a really great exercise for those muscles a couple of times a day, and you can thank me later.
Cool. So, what challenges have you faced in promoting myofunctional therapy within the traditional dental community?
That is the best question I think I've ever been asked. That's one of those hot ones type questions. I've faced a lot of challenges. I think dentistry as a whole is a little reluctant to change. Myofunctional therapy has been around for over 100 years. It originated in dentistry. And it is something where the fathers of orthodontics were trying to figure out what makes people have teeth that aren't in alignment. And it really came down to these orofacial muscles. And I think we've just gotten so far off track from the origins of the profession that it's been hard to come back around. And so I think the biggest pushback has been just a resistance to anything that sounds new, that sounds too different. Even though it's not new and technically it's not really different, we're just dealing with the muscles instead of dentistry is very focused on the hard structures like the teeth and the bone. It's been a struggle just trying to promote because not everybody's aware of it. It just sounds very new, and people are always resistant to change and to newness.
You're right about that. So when you think about your clients that you've had, is there any success story that just stands out that you think about the first time you hear somebody say a success story of someone who's significantly improved through your methods?
Yes, yes. I have a couple that I talk about, but I have one that I talk about probably more than the others. I had a woman who came to me. Her parents had passed not too long before. She had gotten out of a long term relationship. Like everything had kind of shifted in her life in a not positive way. And she was really falling into depression. The sleep was very, very poor, like struggling, could not get any more than maybe 2 hours of sleep a night. And this was with all the efforts of trying and trying, was seeing a specialist for sleep, was taking a lot of drugs to try to induce sleep, and it just was not helping. Got diagnosed with obstructive sleep apnea and had to wear a CPAP. And even the CPAP didn't quite help in the way that, it didn't help to improve the duration of sleep and certainly not the quality of it. So it was working with her and being able to work with her to the point where, she wound up not having to use the CPAP anymore. She got a promotion in the middle of while we were working. Like her mood, her everything, it just really lifted. She wound up working and getting a promotion and just getting her life back on track step by step. And she credits a lot of it to one, being able to sleep, but two, just having a lot more self awareness, because that's the true thing that myofunctional therapy brings. We're not thinking about these muscles. Like we're all focused on the wrong sets of muscles, our biceps, our abs, quads. We're focused on all the big sets. But we don't focus on these little ones that really do make such a big difference in our mental health and our overall health. It's really all about the breath. So becoming hyper aware of this area and really being able to tune into your body at the very beginning of where everything happens. So the very beginning of respiration, the very beginning of eating and drinking and digestion, it it really does highlight so much for you, and you start to kind of learn a little bit more about yourself. So having her be able to kind of graduate from the program and be super successful just personally, but also in her sleep and sleep quality after struggling for so long and using a lot of other methods that just were not helpful was very profound for me.
Okay. Okay. Um, so can you discuss the importance of interdisciplinary collaboration in treating oral facial dysfunction?
Yes, it is incredibly important that you work with other people as a myofunctional therapist. I think some people can go on social media and they might see a whole lot of stuff about myofunctional therapy and they get this idea that it's like the cure all, the end all be all for everything. And I'll tell you, for most people, I work with another collaborator, if not more than one collaborator. So I always have them go to see a manual therapist because what I treat and function, sometimes they need somebody to, like a massage therapist, a chiropractor, a physical therapist, to put hands on the body and to do those releases of those muscles with their hands, so manually release it. When they get that release, how are we able to sustain? Like if you've ever had a knot in your shoulders or a knot in your back, and then you go and you get that massaged out, and then you go back again, and it's like if you get this knot in this same place, that's kind of what happens with some tension in the oral facial region, is that you'll get this tension and it just doesn't go away. And maybe you get it massaged, or, you do cold therapy, so you'll put ice on it, or you do heat therapy and you put a heating pad on it and you get some minor relief. It's the function that really does help sustain that relief. So I always work with someone as far as manual therapy when it comes to muscles, but I also have to work to make space. If there's no space for the tongue, I can't get the tongue to rest up on the roof of the mouth. I have to refer out to an orthodontist or a dentist that is going to do the expansive work that we need so that we can get the space so that I can facilitate this. I really do love collaborating with occupational therapists or speech therapists when there are gross motor skill issues or involved, or speech issues involved. It's always a collaboration. I think it's incredibly important that everybody sees the person from their lens, and we're all able to attack a similar problem at the best interest of our patients from our different expertise and levels.
Okay. So with everything that you do, how are you able to balance your professional life with your personal life? Because I mean, having 4 kids and then trying to do all this and all that, like I know that's a lot. So how are you?
It's a whole lot. That's a really great question. How do I balance? I just try my best, honestly. I am very blessed that I work with my husband on my business. Like, we are partners in the MyoSpot, and so he's equally there. He's there to help me manage my schedule so that it's not too overwhelming. He manages and helps to manage the household, and so it's really a team. I mean, I wouldn't be able to balance and manage anything all on my own. I am incredibly blessed with the support system that I have.
Good. That's good. I ask a lot of people that question about how they balance everything that's going on, and it's like almost everybody, for the most part, has the same answers. Like, I don't know. I just balance it somehow, because you're trying to do everything that you want to do or that you're passionate about, and then do your career and everything, and then also still be there for your family. And it's like, this person needs you, that person needs you. You got clients that need you, and it's like, I need myself sometime too. When can I get that in? You know what I mean? So yeah, so I figure I'd ask that because I know I'd be having hard time balancing as well. Um, so what are some common barriers that people face in seeking myofunctional therapy, and how do you address those?
Yeah. So biggest barrier is going to be a physiological barrier. They just is not enough space, or they're not able to actually breathe through their nose because structurally something's there, deviated septum, enlarged turbinates, nasal polyps. There's any number of reasons that they might not be able to breathe. So structural deviations, if there's not enough space, we're referring out to a dentist for expansion, or we're referring to an ENT. That way we can get clearance and they can get medical treatment for whatever might be in the way physiologically. So physiologically, there's always that aspect of things that for most people, I would say we have to, cross out those things first. But for another set of people who have psychological barriers, I think those sometimes are more difficult to overcome. So those who have, traumas associated with their oral dysfunction, there is a lot that we don't talk about with, assaults of a sexual nature, that there's violence in this head and neck region. And sometimes stimulating muscles in that area, it's a big no-go, or bringing awareness to that area is a big no-go. These are things that can put people instantly in that fight or flight, or that freeze, and drag out their sympathetic tone in a negative way, or put them or activate post-traumatic stress disorder. And so when it's that, I'm always working with someone who is a professional in that manner. So a psychologist, a psychiatrist, a family therapist. That way they can work through those traumas. I do a little trauma mapping, which is like a body work method of, dealing with how we're going to express that through the body. But it's got to be something that they deal with a therapist. That way we can collaborate on both ends, because that's a big stopholder for a lot of people.
Okay. So, is there anything else that you would like to leave with the listeners today before we wrap things up?
Yes, absolutely. I am a big proponent for advocating for yourself or your loved ones. If you've heard all that I've talked about today and you feel like something's kind of resonated with you, I will say that with my children, I let things go on too long and I have regrets about that because I just took the physician at their word. Pediatrician says that they are going to grow out of it. That means they're going to grow out of it. Didn't feel right to me, but I just accepted it. And I wish that I had advocated more for my children to just get them the help that they needed a little bit sooner. Because there are providers out there who will listen to you, who will stop, who will acknowledge and say, okay, you can either wait this out or you can go this path and I can refer you to this specialist and then you can get this tested and like rule this out. There's so many providers who are willing to listen to you and give you alternate plans as opposed to dismissing you. The medical model is not all bad. I don't want that to be the outcome of anything that I've said today. It's not all bad. It's just you have to advocate for yourself. You have to be the person fighting for you because if you don't, nobody's going to fight for you. So if something feels not right in your heart, keep going with it. Find your people. They're out there.
Well, you guys heard it here first. Find your people. She said it. So that's going to be the new motto. Find your people.
Yes.
So, Miss Karese, I would like to take this time to tell you that I appreciate you coming on the show, talking to people about the importance, the talking to people about the importance of their health. You know what I mean? Because this is part of their health. You know what I mean? Some people don't focus on their breathing or like you said, the muscles from basically the nose to the chin area. So I definitely appreciate you coming on today and discussing that with everyone, and hopefully people will listen and start taking it serious or reach out to you, ask questions, and so on and so forth.
Thank you so much for having me. It was a pleasure to share.
Yeah, no problem. So everybody that's watching, you guys, you go to the description. You can find all of Miss Carese's information down below. You guys have just watched another episode of All in All with Alex, and we'll see you guys on the next episode. Peace.